Welcome to the Collection Coach Presents Medicare Decoded, Compliant Documentation. It's easier than you think. Why is Medicare so scary? Isn't it because the Office of Inspector General continues to put chiropractors on their work plan year after year because of inappropriate payments? You can read this report online and many others like it that have been done since. In fact, Palmetto GBA, which administers the railroad Medicare benefits, publishes a report every single quarter. And quite frankly, the results of these reports year after year are embarrassing. And guess what it all boils down to? Chiropractors have horrible documentation. But when you get done with this video, that will all change for you. So what does Medicare actually say about the documentation requirements? And since Medicare is the gold standard in documentation, where do you go to quickly and easily get the information that you need so that your documentation can be compliant? I'm going to show you some important things from this publication, Chiropractic Services. It was published by a former Medicare claims processor, and it doesn't matter that this was published in 2011. The important things that I'm going to share with you haven't changed. So let's get started with the initial visit requirements. The first thing that you have to document is the history. You have to start with family history if that's relevant. Do a past health history, which includes general health, prior illnesses, injuries or hospitalizations, medications, and surgical history. And then document their chief complaint, including the symptoms present that cause the patient to seek chiropractic treatment, mechanism of trauma, quality and character of the symptoms or problem, onset, duration, intensity, frequency, location, and radiation of symptoms, any aggravating or relieving factors, prior interventions, treatments, medications, and secondary complaints. It's important to note that this paragraph does not say and or, it's all of it. The next thing is the description of the present illness, which includes the mechanism of trauma, quality, character, onset of the symptoms, duration, intensity, frequency, location, radiation of the symptoms, aggravating and relieving factors, prior interventions, treatments, medications, secondary complaints, and symptoms causing the patient to seek treatment. It's kind of redundant from the paragraph above, but all of these things have to be documented on the initial visit. The next thing that you need to document is your P.A.R.T evaluation. Your P.A.R.T evaluation is what shows whether you have medical necessity or not to adjust a certain segment. P.A.R.T stands for pain, asymmetry, range of motion, and tissue tone change. Pain and tenderness need to be described in terms of location, quality, and intensity. Asymmetry and range of motion can be documented either sectional or segmentally, and tissue tone changes need to be listed in association with skin, fascia, muscle, and ligament. Then you need to have your diagnosis in order and a treatment plan that is very specific with your recommended level of care, your specific treatment goals, and the objective measures to evaluate the treatment effectiveness. And then don't forget to add the initial date of treatment. For subsequent visits, you also need to review the chief complaint, the changes since last visit, and a system review if relevant. A physical exam, which would include a P.A.R.T exam of the areas that you're going to adjust and that are involved in your diagnosis. Evaluate the treatment effectiveness and assess the change in the patient's condition since last visit. And then you need to document the treatment given on that day of the visit. It's surprising how many times this comes up in the OIG's audit, where chiropractors aren't even documenting that they actually adjusted the patient. We also need to document whether this is an acute subluxation or a chronic subluxation. We also have to document whether or not the patient has any absolute or relative contraindications to a chiropractic manipulation. If the patient has any one of these 13 things, we need to document that we discuss this with the patient, the risk of having an adjustment in that area, or document that we're not even going to adjust in that area. You also need to note the exact location of the subluxation. Note that there are two ways that the level of subluxation can be specified. The exact bones may be listed, for example C5, 6, etc., or The area may suffice if it implies only certain bones, such as occipitoatlantal, which is the C1 or atlas and the occiput, or the lumbosacral, if you're designating L5 in the sacrum, or you could say sacroiliac for sacrum and ilium. Also, Medicare only covers manual manipulation. That's hands-on or an approved device. Manual devices, those that are handheld with a thrust of the force of the device being controlled manually. If it's something other than that, it's not a Medicare covered service. Make sure that's in your documentation. Another thing that causes unnecessary denials are signatures that are illegible. This shows Medicare's response to how a doctor with scribbly handwriting can easily fix that. It says just type your name underneath where you scribbled your signature. Okay, so those are the documentation points that most chiropractors miss in their documentation during these audits, and it causes them to have to pay money back to Medicare. But how did Medicare even come up with all these documentation points? And more importantly, how can you as a chiropractor remember all of those requirements? You're going to do it the same way that anybody would eat an elephant. You've heard this before. It's going to be one bite at a time. A little known fact is that Medicare didn't actually come up with those documentation points specifically for chiropractors under the Medicare system. No, they actually borrowed those documentation requirements from the 1997 documentation guidelines for evaluation and management services. Those 1997 documentation of evaluation and management services are the very foundation of all documentation. So it really doesn't matter whether you're cash, insurance, personal injury, Medicare, Medicaid, workers' comp, it doesn't matter. Your documentation steps are exactly the same. But again, that's a lot of documentation to remember. What we just covered is somewhere between 75 and 200 bullet points of documentation, depending on how many regions you need to adjust. So how are you going to remember all of those documentation points? Is it even possible? Yes, it is, if you have a system that takes you through the documentation process. And that's how the Collection Coach form system helps you make sure that your documentation is bulletproof. So you can see here the documentation requirements and where it's found on the form. This is the very first form that you'd hand to your patients. It's the intake information. The second page continues with the history, getting all of the most important stuff, including the past family and social histories. This next symptom questionnaire is what you're going to have the patient fill out so that you can show their functional improvements over the course of their treatment. And remember those contraindications that we had to record in the chart, either yes or no? We went ahead and added those here too so that you had them on every single patient. And here's a complete review of systems, all 14 body systems, and we've actually related these symptoms back to the spine. All the previous forms are patient forms. This is the first of the doctor forms. Here's where the doctor is going to summarize the chief complaint, history of present illness, review of systems, and past family and social history. And if you look at the graph at the bottom, this is what sets the Collection Coach form system apart from any other form system out there. This is the chart that auditors would actually use to calculate what level of history. You're going to simply do the same steps that any auditor would. Here's how it works. The 1997 Documentation Guidelines for Evaluation and Management Services states that there are 3 key components to building your initial visit: history, exam, and medical decision making. Now, each one of those components actually has multiple components themselves. So you can see the chart below shows that the progression of the elements required for each type of history. To qualify for a given type of history, all 3 elements in the table must be met. And a chief complaint is indicated for all levels. So at the bottom of our form system, we added in your review of systems, past family and social history, and your history of present illness, and you can see how you can tally up all of your bullet points. After the history is the examination. A little known fact is that examinations are also built on a bullet point system. Have you ever wondered how it is that an auditor can look at your documentation and determine whether something is medically necessary or not? It's because they're counting up the bullet points, and they're very specific bullet points. We have them all listed here in our form system, and we've included a chart so that you can actually document your bullet points, check off the boxes just like an auditor would, so that you could know what level of examination that you just completed on your patient. Again, this comes right out of the 1997 Documentation Guidelines for Evaluation and Management Services. Right here under this box where it says the musculoskeletal system, you can see where Medicare took the P.A.R.T. So again, the documentation for your musculoskeletal exam is no different whether it's Medicare, cash, major med, personal injury, or anything else. The documentation points are exactly the same. There are other bullet points too that make up the musculoskeletal exam. Here you can see an example of some of them that we've also included in our forms. In fact, every single bullet point from the musculoskeletal system is included in the collection coach forms. The next step is adding up your medical decision making, and that's also a point system. The Evaluation and Management Guidelines, along with the auditor's checklist, gives us this chart. It's 3 boxes that has problems, data, and risk. So those are the points that you get when you assess a patient's condition. The last step on the collection coach form system, so that you can build your final code for billing, you're going to calculate your level of evaluation and management based on your history, your exam, and your medical decision making. Now, if you have a new patient, you're going to be required to meet the documentation requirements for 3 out of 3. If you're doing a reevaluation or have an established patient, someone that you have not seen in the last 2 years, then you're going to only have to meet 2 out of those 3 requirements. We've also added a spot at the bottom of the page so that you can record your doctor's orders, any medical necessity or rationale for ordering any tests or DME, and you can also use a simple checkbox system for your treatment plan, frequency, and duration. Now, how about those subsequent visits? Well, we know that we have to review the chief complaint, the changes since last visit, and a system review if relevant. So we've built all of that right into your daily SOAP note. We've also built in a P.A.R.T exam so that you can show the precise level of subluxation and your medical rationale for adjusting each one of those segments. Here's a closer look at the form so that you can show the treatment effectiveness since last visit. The documentation booklet that we started out with in the beginning had this to say: ask yourself the following questions to avoid common documentation errors. Does the record show a significant neuromusculoskeletal condition? Is there a precise subluxation documented? Does the exam substantiate the condition and the subluxation? Is there a primary and secondary diagnosis that bears a direct relationship to the primary level of subluxation? Is there a treatment plan? And in order to substantiate the need and frequency of ongoing care, does your documentation note a response to treatment? For example, increased range of motion, increased function, decreased pain? When you use the collection coach form system, you can answer yes to every single one of those questions. So here's a review of all of the forms that you get with the collection coach form system. You get the patient intake forms, which includes the history of present illness, review of systems, past family and social history, and a daily SOAP note. You get the musculoskeletal exam, which goes by the bullet points, including the P.A.R.T exam, the medical decision making, doctor's orders, and treatment plan. Complete diagnosis, designated by cervical, thoracic, lumbar, sacrum, pelvis, and extraspinal segments, and it's updatable. Here's what one doctor said that uses the form system. He says, I used to go to seminars and walk away worried because they would say it's not if you're going to get audited, it's when. Sadly, I knew I wasn't compliant, but I had no idea how to get there, even after multiple seminars. I found that the problem was not the lack of information, but it was too much information. There are literally hundreds of things that I must document in order to be compliant. And although I wanted to be compliant, I had no idea how to get all of the information into the patient record. The resulting uncertainty led me to downcoding my services and not billing for things because I had a fear of an audit, which in turn decreased my production and income. In August of 2007, I implemented the collection coach form system into my practice. The organized and well-planned forms were easy to implement as they seemed to streamline the patient flow. I immediately noticed an increase in production and my income, probably because the patients are now on real treatment plans and I wasn't skipping re-exams. But the patients also liked it better because they would communicate their complaints to me more clearly and they could see their progress at each re-exam. What's even better is I no longer live in fear of an audit because when you use these forms, it's like looking right at the Chiropractic Services Manual from Medicare. These forms follow that manual precisely. Now my headspace is freed up to do what I do best, treat patients. Without a doubt, this is the best paper form system for compliance, ease of use, and to increase your income. And here's what another doctor said. The collection coach is a very comprehensive, intuitive collaboration of forms that allows you to keep your office compliant whether you're cash or insurance. In today's world of insurance rules and regulations and documentation concerns, the collection coach helps ease your concerns of compliance. My office has been using the collection coach forms for the last year and a half. With these forms, we have seen our collections increase and our office run smoother. The design of these forms takes the guesswork out of what you do. The forms are designed to check and double check your coding and assist you in billing what you do more accurately. I highly recommend these forms.